All right. So before I get started today, I want to take a minute to thank my co-author on this paper, Katie Orrick, who is now a high school teacher in Indiana and who is one of my research assistants on this project. In addition to Katie, I also want to thank the rest of the team of graduate students and undergraduate students and staff who assisted with this project, along with the Indiana Clinical and Translational Sciences Institute and Indiana University, who provided funding for this work. And so this was, a huge team effort, as I'll talk about in terms of the data collection involved. And that's, part of the reason to start things off this way. So in terms of the project, in March 2020, and in the wake of the COVID-19 pandemic, schools across the US and many parts of the world shifted to remote instruction. And some continue to offer only remote instruction well into 2021, well into the following school year. These closures were intended to reduce the spread of a deadly and highly contagious virus, and they were, by many accounts, effective in helping to achieve that goal. At the same time, and by the summer of 2020, some parents, and disproportionately, at least in a US context, affluent and highly educated white parents were calling for schools to reopen. And during the 2020-2021 school year, at least in the US, in-person attendance varied substantially by race and by class, with white students from affluent and highly educated families being disproportionately likely to choose, because this was oftentimes left up to not only school districts at the local level, but also to individual families to decide whether they wanted to send their kids back to school in person or to have their children continue learning remotely from home or from other types of remote situations. So these kinds of patterns may seem paradoxical, given that affluent and highly educated white parents were the ones who were disproportionately able to work remotely during the pandemic. And so we might assume that they would be better positioned than parents from other more systematically marginalized groups to be able to support their children's learning while schools were closed. At the same time, and as I'll talk about today, there's reason to suspect that these patterns aren't as paradoxical as they might seem. Research has shown, for example, that affluent and highly educated white mothers, particularly in the US context, were disproportionately approaching remote learning through a logic of intensive parenting. And given how intensive parenting tends to prioritize concerns about children's academic achievements, it seems possible that these kinds of intensive parenting logics may have led parents to choose in-person schooling regardless of the potential health risks, by shaping how parents weigh these different potential risks to kids' well-being. And then moreover, given the stress that we know intensive parenting places on parents and particularly on mothers, even in normal times, even before the pandemic, it seems possible that in the context of these kinds of heightened challenges, intensive parenting logics may have led parents to experience extremely high levels of burnout, and thus to ultimately choose in-person instruction as a way to help alleviate the stress that they were experiencing in that process as well. And so my co-author and I consider these possibilities by examining how the parenting logics that families adopted during the early stages of the pandemic, when schools and childcare centers first closed, how those influenced the decisions that they made during the 2020-2021 academic year, when in the US, that's kind of where schools started to reopen and where families started to have the choice of sending their kids back to in-person school. For this project, we draw on data from a longitudinal qualitative study that followed 250 Indiana families over 4 years, involving 7 waves of data collection that started back in 2018 and then followed the same families through 2020. It didn't start out as a pandemic parenting study, obviously, but it became one in the process of some of the data collection that we did. We initially recruited families for the study through prenatal clinics in Indiana. Pregnant people, all of whom identified as women, so I'll talk about them as women or mothers today, were invited to take part in surveys about the kinds of parenting decisions that they intended to make for their new babies. And about half of those pregnant women that we initially surveyed were first-time parents, and about half had older kids, ranging in age from toddlers up through high school students. And so for this analysis, we focused specifically on the moms who had school-aged kids at the start of the COVID-19 pandemic, so pre-K up through high school, and specifically those who participated in the qualitative portions of the study that took place in 2020 and 2021, including in-depth interviews that we asked them to complete about pandemic parenting, and also diary surveys where we asked mothers to write about their experiences during the pandemic, which was helpful, especially for those who couldn't find time to do interviews, given the challenges that they were facing. So based on those criteria, the focal group for this paper includes 66 moms from varied backgrounds. All of them had at least one child under the age of 2. That was sort of how they got into the study. And then all of them also had at least one additional child who was old enough for, like I said before, pre-K or elementary or middle or high school. So Analysis-wise, we started out by reading mothers' interview transcripts and diary entries and open-ended survey responses and using these data to identify sort of typologies of parenting logics that parents were applying with remote learning in the spring of 2020, during that sort of early period, the first wave of pandemic data collection that we did. We had already been in the field doing surveys and interviews, and so it became apparent from those surveys and interviews in the early part of 2020, like February and January, that things were starting to become complicated for families. And so we kind of got additional funding to do these pandemic interviews that we did in the first wave was in April and May of 2020. We did 65 interviews in 4 weeks in April and May of 2020, which was just a bonkers level of data collection. But anyway, that kind of did more beyond that. And those early interviews is primarily what we use to identify these early logics that parents were using in terms of approaching remote learning. And we divided them into 3 categories. So intensive logics, these were mothers who saw it as their responsibility to prevent the pandemic from negatively impacting their kids' academic and cognitive and social development. And they devoted considerable time and energy to those kinds of efforts, including by doing things like supplementing the remote instruction that their kids were getting from their local schools. They also often expressed tremendous levels of guilt when they were unable to provide that kind of supplemental support. And they often sacrificed their own well-being in order to be able to achieve those goals. Realist logics, on the other hand, the mothers who fell into this category tended to believe that in the context of a global pandemic, it might not be reasonable or appropriate for kids or for parents to devote the same level of time or energy to things like academic and cognitive and social development as they did before the pandemic. And these mothers typically tried to ensure that their kids completed either all or most of the work that their schools were assigning, but they rarely supplemented those kinds of school assignments or activities. And some even said, you know what, this isn't reasonable. We're going to kind of even scale this back more. And they also tended to allow their kids much more unstructured time, including things like screen time, than they had before the pandemic, and tended not to express a high level of guilt about doing so. They sort of saw this as kind of, this is just necessary. This is what we have to do to make it through. And then at the same time, there was a sort of third category of moms here who either we kind of the mixed or moderate logics, where they were either switching logics early in the pandemic. They sort of tried one thing for a couple days or a week or so, and then said this isn't working and tried something else instead. Or moms who kind of fell in between in terms of the ideas that they were expressing. And so once we put mothers into these categories, we then reread their interview transcripts and diary entries and open-ended surveys, and kind of wrote analytic memos, kind of unpacking the stories of each of these mothers who fell into these categories, and revealing kind of reoccurring themes related to things like intensive mothering and trust and role conflict, which I'll talk about today. We also created spreadsheets where we sort of coded each mother according to these different categories, and I'll present some of those analyses, mostly just to give you a sense of the patterns in these data. They're not representative of the US as a whole, obviously, but they can help us to better understand the links between these different types of parenting logics and the kinds of decisions that parents were making in this particularly complicated time. So overall, we find a link between parenting logics and school choices. Let me back up a second here. So we find this link between parenting logics and school choices, where with mothers who adopted intensive logics during the early stages of the pandemic, disproportionately choosing in-person schooling for the 2020-2021 school year. And as I'll talk about, they did so for a number of reasons that I'll unpack that have to do with trust in schools, the kinds of role conflict that mothers experienced, and also the kinds of coping strategies that moms had access to by virtue of these logics that they could use to avoid the kind of burnout that they might otherwise experience with these sort of proxy educator roles that they had to take on during the pandemic. So there were differences among these moms in terms of differences by education level, and to a lesser extent, differences by income, and in the kinds of patterns that we saw and who was adopting which logics. At the same time, we saw kind of stronger patterns when it came to a link between these kinds of logics that parents were adopting and the kinds of school decisions that they ultimately ended up making. So this is the kind of how these different groups of logics vary according to the choices that moms ultimately ended up making around whether to send their kids to school in person during the 2020-2021 academic school year, with those who applied these kind of intensive parenting logics disproportionately choosing in-person schooling. All right, so what's going on here? So how do we explain these patterns? What we find is that intensive parenting logics prompted preferences for in-person schooling by leading moms to question whether their kids were getting a good enough education with remote schooling online. And in light of those kinds of questions, mothers tended to intervene to offer supplemental instruction beyond what the school is providing. And those Supplemental efforts were then really what was driving the role conflicts for mothers, which led to burnout, particularly because intensive parenting logics tended to limit the kinds of coping strategies that moms could use to manage the stress that they were facing in the process. So I'll tell you, for example, about a mom who we call Janice. All the names are pseudonyms. She's an Asian American mom with a bachelor's degree. She's a stay-at-home mom and a former mental health counselor. And she found herself supervising her second graders remote learning, or sorry, her first grader. She was in first grade at the start of the pandemic and in second grade the following year, while also caring for a toddler at home. During the initial transition to remote learning, Janice was concerned that her daughter's teacher was not providing sufficient structure or educational content. She said in an interview, quote, her school district was not doing any kind of e-learning at first. They just kind of took the 20-day waiver from the state and said, we're not going to be doing anything. The e-learning through her school just started a week ago. This was in April 2020. And her teacher, the work he was assigning the kids last week and this week, it's been really boring. And I know she doesn't like it. So I don't want her entire school day to be just what he's assigning. I feel like what I'm doing is the main thing and what he's assigning is some supplemental stuff. It's probably the opposite of other parents, but it's what's working for us. So given those kinds of concerns about the quality of education her daughter was getting, Janice ended up developing her own school schedule for her daughter, including supplemental instruction and activities that went well beyond what the school required. She talked me through their kind of whole schedule, and she said, one of the first things I did was teach my daughter how to read a clock, so she knows what's going to happen at what time. Breakfast is at 9, and my kids play together until 10, and 10 is when school starts. And from 10 to 1, so 3 hours, we have school and it's broken down into different subjects. 1 o'clock is lunchtime, and then there's outdoor recess. Then there's an hour of indoor play where the kids are both awake and playing together. And then at 3 o'clock, there's another nap time for the baby. And 3 o'clock is when my 7-year-old goes back to school until 4:30. So all in all, she gets 4.5 hours of school time a day, and it's broken into a lot of different things. She's in first grade, so we're learning about money, we're learning about clocks. She's got a lot of educational toys, and we're doing reading, either reading aloud or she's reading to me. It's a little bit different hour by hour. And then when the baby wakes up from the second nap, it's time to be done with the school day. So we hear here that she has this kind of intensive school schedule that she's planned for her daughter. And during the first week or so of the pandemic, April's daughter had accepted this schedule, kind of going along with it willingly, though her mom actually skipped spring break and didn't tell her daughter that they were going to keep learning every day through spring break. Anyway, but by early April, her daughter had started to resist, had started to get frustrated with this kind of intensive schedule. And that resistance led to conflict for Janice, including role conflict between her role as a mom and her role as an educator, and with her daughter too. She said, the last few weeks, it's been really challenging. She's been challenging my authority left and right. Sometimes she doesn't want to do something, or she keeps on talking and she's not getting anything done. I tell her she needs to be silent until she finishes writing. Today, it was the months of the year. I was like, no, you're going to have to raise your hand if you have anything to say. And she's giving me the mom. And I was like, no, I'm not your mom, teacher. So I just left the room and had her do that again. But yeah, it's things like that, which happens every 5 minutes. So essentially, given this experience, Janice had kind of those first early weeks of the pandemic when things were going well, Janice had considered switching to homeschooling permanently. She's like, oh, I'm doing great at this. This all seems really good. But the role conflict she experienced with her daughter, on top of the sort of lack of trust in the quality of remote instruction, ultimately pushed Janice to opt for in-person schooling when her daughter's school reopened in the fall of 2020. She said in January 2021, she said, over the summer, we moved to a different school district that's one of the best in the state. Initially, we were not given an in-person spot for my second grader, so our only option was remote learning. We decided not to enroll her and started homeschooling, but then a day before the public school was set to start, a spot opened up in school and we enrolled her after given an extensive private tour of the building in which the safety protocol was discussed. I volunteer there weekly to keep an eye on things. So as we see here, Janice's skepticism about the quality of remote instruction led her to supplement what she was getting from the school. But those efforts were so intensive that they led to role conflict for Janice, who then struggled with trying to be both teacher and mom. And so when it came time to decide for school for the 2020-2021 year, Janice decided that the best option would be to send her daughter back to school in person, despite the potential health risks, and albeit while staying very heavily involved in the process. Now, this kind of role conflict that I'm talking about here with Janice was kind of even more pronounced among mothers who were working for pay while they were also helping their kids learn from home. So I'll tell you about a mom named that we call Marley, who's a white mom with a bachelor's degree. She was able to do all of her paid work from home during the pandemic, working full-time as a financial administrator. But her husband, Russell, who's a healthcare provider, had to continue working outside the home. And so Marley became the default parent, the sort of proxy educator for her two elementary-aged kids, while also caring for a toddler at home whose childcare center closed. And Marley, like Janice, adopted this sort of intensive approach to remote learning, aiming to, she called it fill in the blanks with what her kids were getting from the school and ensure that they'd continue to thrive despite the kinds of challenges that they were facing with the pandemic. That approach created considerable conflict for Marley, especially between her paid work roles and her parenting roles. She wrote in her diary entry in April of 2020, "I had to be home with my kids and try to be a teacher, a mother, and an employee while my husband worked in his field outside the home. It's daunting at best and completely exhausting. I enjoy seeing my kids get along, but that doesn't always last very long. I took a long walk with them to try to ease the tension. I'm not coping well, and I always try to ensure, and I'm not always sure how to recharge my own battery." So the stress of these kinds of conflicts took a heavy toll on Marley. She actually gained 40 pounds during the first 3 months of the pandemic, in part because of the stress that she was facing and not being able to exercise the way that she previously had, given the demands that she was facing and trying to, she would kind of stay up really late working to get stuff done because she couldn't do it with the kids home during the day. At the same time, and despite that sacrifice, Marley was still worried that her kids might not be getting the level of support that they needed to stay on track, both socially and academically. And so, at least initially, she eventually opted to send them back to school in person. She wrote in a response to an open-ended survey question, "We started the academic year with remote learning. My husband and I decided this was because his mother has terminal cancer, and we wanted to keep them as safe as possible to be able to continue seeing her in person. However, they were struggling, and we chose to put them back in traditional school." So she elaborated in an interview saying, "I had all three kids at home and I was trying to work full time. We tried virtual school and it was just awful. Every day was a fight. And my son ended up having tremendous emotional issues as a result. And I had to go back to, I'm just pouring my heart out to you here. I had to go back to therapy in October as a result. I was in a deep depression, a really dark place. And my therapist told me first thing, she's like, get your kids back in school. And so I did, and it's gotten a lot better." So this kind of burnout that Marley was experiencing ultimately persuaded her to send her kids back to school in person, even though she had concerns about, her kids getting her grandmother sick, who was in a precarious state health-wise. At the same time, and though it's interesting here that consistent with this logic of intensive mothering, Marley also kind of had to justify that choice, not only by saying the benefits for herself, but also trying to point to the academic and emotional benefits that she thought going back to school in person would have for her kids. And so kind of essentially she was only able to release herself from this sort of proxy educator pressure that she was putting on herself when she was able to reframe the kind of return to in-person school as what was truly best for her kids and not just what was good for her own well-being in the process too. Now, we can contrast the kinds of approaches that we've heard with these two moms with the kinds of realist logics that other mothers adopted when it came to early pandemic learning. These logics discouraged moms from choosing in-person schooling by allowing moms to trust that the education their kids were getting online was good enough, given the pandemic conditions they were facing. In light of that kind of trust in schools, these moms didn't tend to feel compelled to supplement the kind of school-provided instruction they were getting, or even in some cases to have their kids do all of the work that was assigned. And by virtue of that more relaxed approach, these moms also tended to experience less role conflict. And when they did experience stress, they also had kind of more coping strategies that they could use to avoid burnout while their kids were at home. I'll tell you the story of one mom who we called Trisha, who's a white mom who has some college education. She's a childcare provider who works at a childcare center that closed during the start of the pandemic, which left her at home with her preteen son, her preschool-age son, and their toddler, while her husband, who's a corrections officer, continued leaving the house for work every day. Trisha approached remote learning with what I would consider a realist logic. She sort of trusted her son's school to provide adequate support and instruction, and didn't try to supplement what her 11-year-old was getting, and really didn't do much school stuff at all with her preschool-aged son while he was home in the process. We had an interviewer asked her, "So what about your 11-year-old son and schoolwork?" And she said, "I try to do what I can while the other two are sleeping and things like that, but there's a lot more than I thought there would be. He's having to do his creative writing assignment, and there's a research paper on top of the math, which I don't really get at all because it's totally different than what I was taught in school. He's been pretty good and his teacher's been great. We've been able to contact her if we have any issues. I think it's going better for me than for most people, but it's still a little stressful." And then we asked her, does your oldest child, does he Skype or FaceTime with friends? Like, how is he doing socially? And she said, yeah, actually they do a class meeting like on every Wednesday. So all the kids get on through FaceTime and through their Canvas thing or whatever with their teacher, and they talk a little bit and they talk about how schoolwork is going. So that's been pretty nice. So essentially, even though Trisha found remote learning to be a little bit stressful, she mostly trusted her son's teacher and trusted that he was getting enough support both academically and socially, despite being fully online for school in the spring of 2020. Given that kind of trust, Trisha didn't seem to feel compelled to go above and beyond with her son's school assignments. And as a result, she really didn't experience the kind of role conflict that mothers like Janet or Janice and Trisha, Janice and Marley, who we talked about before, were experiencing in that process. And so as a result of that, in the absence of that kind of role conflict, Trisha decided that it made more sense to keep her son learning at home during the 2020-2021 school year. She said, if you can do it online, I feel like that's the safer option. I plan on just keeping him in remote school basically until the pandemic's over, if that ever does happen. This was in January 2021. She said, I know he misses his friends, but he'll make do. He has a computer and he'll play online games with his friends and stuff, so he's still getting some of that socialization. But from a parent and a safety standpoint, I don't think I could send him back until things are better. And so essentially, Trisha was able to kind of, by virtue of the lack of academic pressure, sort of intensive parenting pressure, she felt she could prioritize health as the primary thing that she was considering when it came to sending her son back to school. And then she was also able to do so because she had her son's retired grandfather. She asked him to help supervise her son while he was home because she had to go back to working in person as a childcare provider once the school year started up again in 2020. So it wasn't that she was able to stay home, but she was able to find someone else who could do that. And really, she was able to do so in part because she just trusted that her son was going to be able to get the kind of support that he needed as he was learning online. Now, as I mentioned before, some moms did adopt more mixed logics around parenting and the pandemic. A few moms, for example, initially tried to adopt a more relaxed approach, but then switched to a more intensive approach when they saw that their kids were struggling academically or behaviorally while they were learning at home. That included a mom that I'll call Samara, who's a Black mom with an advanced degree. In the spring of 2020, Samara was working full-time remotely. She was a director at an agricultural production company, and she was also caring for, she had two kids in elementary school and one who was a toddler. And at first, Samara and her husband, who was also working full-time remotely, tried to take a more realistic approach or a more realist approach. And she said, with things that maybe would have been a bigger deal before the pandemic, we were trying to be a little bit more relaxed on those things, and screen time definitely went up. We're at the point now, though, where we're definitely moving back from that and using it more sparingly in the evenings for sure as we can. There was definitely a crutch to just make things easier a little bit for the kids. And Samara went on to explain that she and her husband abandoned that more realist approach when their son started struggling academically. She said the assignment piece is very challenging if they're not turned in on time. The teachers weren't leading them through, or not hounding them enough to turn in their assignments. With the online submission portals, it's due here and you turn it in or you don't. So that was a transition. And then just being online, I think it got away from him really. And we really had to, I mean, there was one point he was failing in some subjects and I was like, whoa, he's mostly an A student. So that was really concerning. We got him to where he needed to be, but it was kind of late in the term. And so that work of trying to get her son back on track kind of was both a wake-up call for Samara in terms of shifting the logic that she was using to think about pandemic learning, but it also took a toll on her, particularly because her husband was required to go back to work on site starting in the summer of 2020 while she stayed home for that full summer with her kids. And she described it as taxing, having to choose between prioritizing her kids' needs and prioritizing the well-being of her employees that she was responsible for overseeing, who, unlike her, this is a production facility, they didn't have the option to work remotely. And so she said, it weighs on you as a leader. And are you doing enough to keep people safe, but knowing that they have to be there? They don't really have a decision to work from home when you're on a manufacturing or production line. So making sure you're doing enough, it weighs on you. And so again, this is sort of a classic case of role conflict between her role as a mom and her role as a professional. And it also led to kind of coupling that with concerns about her kids' academic process. In light of those kind of confluence of factors, Samara ultimately decided to send her kids back to in-person school and childcare in the fall of 2020 when things reopened. She said, I'm selfish in that I feel like schools should be open because I mean, without it, I wouldn't be able to do what I need to do from a work aspect. But it's kind of twofold because I think my kids really just need that kind of structure of they learn better in that environment. Then two, you think, but are we doing enough to keep the safe distance and be safe in those areas? And maybe not. And so here we hear that ambivalence. And we also hear that, like Marley, Samara felt guilty about wanting to send her kids back in person, particularly when it was framed in terms of the role conflict and burnout that she was experiencing, because she worried that doing so would come with health risks for her kids or for other people in her community. At the same time, though, and also like Marley, Samara found that she was ultimately able to justify making that choice kind of by adopting this logic of intensive parenting, and particularly its emphasis on prioritizing kids' learning over other possible concerns, over the health risks that were potentially involved. Now, of course, there were some variations in these patterns. A few moms, for example, adopted realist approaches, but then ultimately had to send their kids back to school in person because, unlike Trisha, they didn't have someone to care for their kids while they were learning at home. And a few of the moms who took a more intensive approach ultimately opted to keep their kids home because something happened to trigger high levels of concern about potential health risks. That included a mom that I'll call Erica, who's a Latina mom with an advanced degree, whose kindergartner's school closed at the start of the pandemic, and whose teacher was providing live instruction. She was only getting 30 minutes of live instruction a week over Zoom, and everything else was just supposed to be done with packets. And Erica was deeply dissatisfied with that arrangement, and so she opted to cut back her paid work hours to just a few hours a week so that she could kind of develop a whole intensive school schedule for her daughter. And at the same time, she hoped that would make it easier, but with her daughter in kindergarten and then also a toddler at home, it became sort of increasingly challenging for Erica to manage. And she, because of the stress that she was experiencing in the process, like Marley and like Janice, she initially thought she was going to send the kids back to school in person in the fall of 2020. At the same time, and she talked about it in April, kind of earlier that year, saying that she was planning to send her kids back if they reopened. She said, my daughter's school posts some resources online, like some videos or crafts that you can do, but that's about it. And really, parents, you're just on your own. And if your child is someone who wants to be with other kids, there's this missing piece, and it's really hard. My daughter's just bored. She's playing, but it's not the same. And so at the same time, so Eric was planning to send her daughter back, but then over time, case numbers started to rise in her community. And over the summer, her husband, who by that point had gone back to work in person himself, persuaded Erica that if she could stay home with her daughter, she should keep the kids home and not put them back in school because of the potential health risks involved. And she said, she talked about it later that year in February of 2021, saying, my daughter was signed up to go in person, and then we just chickened out. We just felt like, okay, if she gets sick, huge things could happen. If she gets sick and she's fine, she could give it to us, and then huge things could happen. And we just felt like we couldn't take that risk. We talked to other parents, and one mom said, we're absolutely picking our mental health over our personal safety because we can't do it anymore. And I felt like that so many days since then. So as we hear here, there was sort of an ambivalence in the sense that Erica was getting pressured to send her daughter back, but she was like, she knew it wasn't the best thing for her personally, but she had, especially through her husband, was getting pressure to see this as the best choice to make health-wise. At the same time, it did end up taking this huge toll on Erica to have to be that proxy educator. She said, it's hard because I feel like my daughter doesn't want to do her schoolwork, and this is during that 2021 year when she chose to be remote. And she said, it's hard because I feel like my daughter doesn't want to do her schoolwork, and half the time she doesn't want to do it because it's at a level that's too low for her. And simultaneously, some of it is too hard and too low. Yesterday, one of her assignments was just to write 2 lines of a period. Why would this even be an assignment? I guess for some kids maybe, but some of it's fine. But some of it I think she doesn't want to do because she's bored, or she has a cutting assignment that she has to do today. And so she talked about how in order to supplement what her daughter was getting, and given the pushback that she was getting whenever she tried to give her daughter extra assignments to do, she ultimately decided to hire tutors that would come and work with her daughter on the weekends for a couple of hours, both to give herself a break and then also to make sure that her daughter was keeping up academically, because she was putting up so much resistance when Erica would try to provide that kind of supplemental instruction herself. And so this was, deeply stressful for Erica. And at the same time, she tried to cope by focusing on the positives, on the fact that she was trying to keep her kids physically safe. That kind of cognitive structuring, though, I talk more about the coping strategies in the paper, and I don't want to take up too much time, but it was difficult to sustain, and it tended to lead to these feelings of detachment, which is a sort of classic symptom of burnout. By February 2021, for example, she was saying, there's nights where I just sit on the couch and I review the day, and I just feel like I spent the whole day saying, okay, pick up, do this, do that, sit down, pay attention. What are you supposed to be doing? Focus, focus, focus. And so ultimately, by the summer of 2021, Erica decided that she couldn't do it anymore, that she couldn't meet her daughter's needs independently, and especially with her younger one, now old enough for preschool. She's like, I just can't do this anymore. And so she decided she was going to send them not only back to school in the fall of 2021, but also to summer camp during the summer, so that she could just have the summer to herself to be able to get them back on track. And then, but at the same time, she justified it in terms of wanting to make sure her kids had the socialization that they needed to be able to make it through. All right, so to sum up here, and even with these kinds of variations, the data that we have from this study suggests that the parenting logics that parents were adopting, particularly during these early stages of the pandemic, likely played at least some role in shaping parents' decisions about whether to send their kids back to school in person when they had the choice during the 2020-2021 school year. And we find that those logics mattered for parents by influencing the extent to which mothers trusted the school to provide high quality remote instruction, And that trust ultimately affected whether they tried to go above and beyond, tried to offer supplemental instruction beyond what the school was requiring. It also influenced the kind of role conflict that mothers experienced in their proxy educator role, which affected the level of burnout that they experienced, the kind of stress that they experienced while they were trying to fill these multiple roles at home. And it also affected the kinds of coping strategies that they could apply, which affected their ability to persist with remote learning through the stresses involved, particularly in the long term, and to be able to make it work. And so we talk in the paper about how these findings have a number of important implications for research on parenting, on education, and also on public health. First, for example, they highlight the resilience of parenting logics, showing that normative pressures led mothers to feel as though they had to continue parenting intensively, even in the context of massive disruptions to their lives and to their children's lives. The second, these findings reveal how parents' logics may influence parents' weighting of various potential risks to their kids' well-being. We know that kids' rates of serious illness and death from COVID were lower than those of adults. Yet we also know that many kids did experience serious and lasting complications from COVID, and that kids also, the evidence has increasingly shown, played a key role in transmitting COVID-19 to others, even when they were asymptomatic. And particularly once they returned to in-person school. There's been some interesting research done in the US comparing when schools reopened and how that linked to rising rates in communities. At the same time, and so given those kinds of health risks, we might have expected most parents to prefer to keep their kids home if they had the option to do so, particularly given how unchecked the spread of COVID was in the US more generally. Instead, and as we see here, intensive parenting logics tended to lead especially privileged parents, but any parent who was able to parent intensively to weigh the academic and social risks of remote learning often more heavily than the kinds of potential health and safety risks that they might have otherwise seen with in-person school. And then relatedly, and finally, these findings also highlight the role that intensive parenting may play not only in driving inequalities in education, but also inequalities in public health. We know that the pandemic, both in the US and globally, has disproportionately affected people from systematically marginalized groups. And yet, as we see here, intensive parenting logics helped parents to justify, particularly privileged parents, to justify putting their own kids ahead of others, even when it came to matters of potential life and death. So thank you all so much for being here today. I'm looking forward to your questions and your feedback. And thank you again to Max for inviting me to share this with you all.